Hi everyone. I'm wanting to talk about two graphs that I use with patients to try and explain sometimes where they're currently at and where they want to get to and how we can help them with that process. This is directly lifted really from the work of Louis Gifford and his excellent books, Aches and Pains, that you can find online and by covering all these lecture series that are really excellent and would definitely inform your practice. So I explained to the patient we've got the coping graph, and maybe this demonstrates where they're currently at. So along the left-hand side axis, you've got your capacity to cope or your battery level, really. So when your battery level is full, meaning you're well slept, your diet's good, you're exercising, your health is good, then basically you're a strong, robust and resilient organism. If you then get some bad news or a bit of stress, maybe some bad family news or a work deadline, yes, it's difficult, but because you're already strong and resilient, you can generally bounce back from that quite quickly. If you did add a pain problem and ongoing stress to a strong organism, then over time, you're going to see some changes. And this is largely based on the researcher Hans Selle, who did a lot of work on rats in the 1940s and 50s and came up with really the kind of adaptation to stress model. So initially, we're going to get alarm to the pain problem, the kind of early response to the pain state, seeking help, getting treatment, trying to solve the problem. If the problem doesn't go away, we can get into the resistance / fighting and maybe coping. Over time, though, we're going to slowly reduce our battery level, ultimately to the point where we're probably just coping and basically quite exhausted with the whole situation. I then explain if you get the same bad news, there might be a work deadline or some bad news from the family, because we're not resilient anymore and maybe a bit more vulnerable, then our ability to cope is at its kind of lower levels. And this is when we can get this flare up and that up and down on that ability to cope when we're getting bad news or difficulties in life or just ongoing pain. So often this is maybe where they're at, or this is maybe where they're at, or this is, building back up and this is where they want to get to, back to this strong organism level. So how are they going to get there? Ultimately, we're saying there's no quick fix. So I explain this with the recovery graph. Often I'll talk about Dr. House, the Hugh Laurie program where he knows exactly what you need. It's this treatment or this tablet, but ultimately it's a TV show and it's not the reality of the situation. So a quick fix is unfortunately not available, but there is hope and there is a path. So on this axis, we've got health and well-being, and then time again on the bottom. So we're starting potentially sometimes from this point of low confidence, maybe a bit pessimistic that this is going to help at all, a low kind of sense of control or potentially the external locus of control rather than the internal. Pain is a large part of the problem and it gets lots of attention, lots of fear, lots of anxiety. And as we know, the kind of the psychosocial and physical elements are all not maybe where they want to be. So we've explained that there's unfortunately no Dr. House, but we do have this recovery. So it starts with what we do, which is explanation, validation, and reassurance. Then we've got acceptance. It's easy to say, sometimes difficult to talk about, I find, but it's harder to do. Acceptance isn't the kind of passive resignation of the issue, it's actually the opposite. So it's acknowledging what the issue is and then starting to make those active steps forward towards recovery. Belief and optimism, very important that improvements can be made. Looking at a slow, graded, gradual increase in function and fitness, and it's making that function and fitness relevant to them. So whether it's walking or playing with the grandkids, not necessarily standard specific, say, exercises for low back pain that they may have done before. Starting to move attention away from the body, So less kind of worried about a body part or worried that they're going to do more damage, more confidence, and then ultimately getting to this kind of faultless, fearless movement. So being in control, pain is far less of a problem, lots more confidence and lots more optimism. So I find this works really well, actually drawing it out when I'm working one-to-one, or certainly works well for a pain management program if I've got a flip chart, drawing it out. And often we're asking people where they are on this line, where they want to get to, and also saying it's not necessarily just a smooth line like this. It might be a bit more of a Toblerone effect, but hopefully we're heading in this direction. So I'd recommend you use it, and certainly nice to write out, and then you can give it to the client to take home. Okay, thanks for listening.